welcome our witnesses who are giving evidence to us this morning from the Health and Safety Executive and Public Health England. Can I thank you all very much for coming and being with us today. What I'd be grateful for would be if each of the witnesses in turn would introduce themselves so that everybody knows who you are. And let's start, if we can, with Martin Temple.
Martin Temple, Chairman of the Health and Safety Executive.
Thank you very much. Sarah Albon.
Hello, I'm Sarah Albon, Chief Executive of the Health and Safety Executive.
Thank you. And Professor Andrew Curran.
I'm Andrew Curran and I'm HSE's Chief Scientific Advisor.
Thank you. And Professor John Simpson.
I'm John Simpson. I'm one of the Senior Medical Advisors for Public Health.
Thank you. Thank you all very much indeed for joining us. We've got a series of questions that we'd like to put to you, but we're starting this morning with a short statement from the Chair of the Health and Safety Executive. Martin, I think you're planning to give that statement to us. Please go ahead.
Yes, thank you, Chair. I felt it might be appropriate to give you a brief introduction outlining the range of activities that we've been carrying out relating to coronavirus, and no doubt you will have asked more specific questions later on. Now, the first area has been our real desire to enable work to continue where possible and protecting those at work. And to that end, we've been updating and revising proportionate operational policy positions to a wide range of industry stakeholders and sectors, and keeping that advice constantly reviewed and updated in light of the current scientific discovery and new knowledge we get around the pandemic. And there is a dedicated coronavirus microsite available from HSE, which is free for people to subscribe to. And as things evolve, if you are subscribing to it, you will get the free updates in the areas that you're particularly interested in. So I think that's very useful for people out there wondering what to do. In the area of RPE and PPE, we've been advising businesses, including the NHS, on ways of working and implementing specialists, how to efficiently manage the provision and use of RPE, including the reuse of disposable RPE and alternatives to certain items that are under significant supply pressure. And we've been looking at the applications for manufacturers offering new products and seeing if we can support the technical assessment of these products as well as sources coming in from overseas. And in the area of general guidance, we've been supporting Public Health England and in Scotland and Wales in the review of guidance for workers, including general infection and prevention control, secondary care, including handling clinical waste, and prevention of infection from the deceased. Now, in another area, laboratory capacity, for example, which is an area that laboratories, an area we do regulate, is in general. But we have agreed proposals for a change in the ways of working for those laboratories that were putting themselves forward to screen COVID-19 samples. And as you know, that's been a very important element going forward in government policy. And we amended these things in view of exceptional circumstances. And our microbiologists have been working on this whole area of testing capacity. Another area is in things called biocidal products, which is related primarily to things like hand sanitizer products. We are, again, an approving body for a wide range of chemicals, and we've been able to facilitate the increased supply of these biocidal hand sanitizers by unblocking some of the obstacles in some of the regulations that existed. And this allows, for example, and people will have seen it in the press, drinks manufacturers to redirect production of ethanol away from drink manufacture into the supply chain for hand sanitizers, for example. Now, on regulatory activity, I think many people probably don't fully appreciate there's been still quite a lot of people working, for example, in agriculture, some areas of construction, and large areas of manufacturing. And since the lockdown, we've had approximately, well, in fact, in excess of 4,500 concerns, which have been looked at or been continued to be looked at. But what I think the committee should be fully aware of is that across all sectors, we've been continuing to investigate work-related deaths, the most serious major injuries and dangerous occurrences, and reported concerns from the workforce or the public where people have been exposed to risk from work activities. And we will take action to secure compliance with the law where necessary. The penultimate point I would make is about social distancing. We've worked closely with other government departments and the devolved areas on social distancing. We have a concerns and advice team, which is providing advice and information on social distancing and to employers and workers. And that's been expanded, and I think Sarah may talk about that a bit more later. But probably one of the most important points I could make is that under the Health and Safety at Work Act, employers have a general duty to ensure that as far as is reasonably practical, the health and safety and welfare of the employees at work is looked after. But HSE considers that if an employer is following the relevant Public Health England or Scotland or Wales guidance for their sectors in terms of controlling the public health risks, they will be taking reasonable, practical precautions to control workplace risk. The last point is that we've been heavily involved on return to work, working closely with BEIS, with Cabinet Office, business organisations, TUC, unions and trade bodies. And there's, of course, a lot coming out today and yesterday on that matter. And again, I think that will come up later in the committee session. Thanks very much.
Thank you very much for that introduction. We'll certainly come back to a number of those points in the course of our time this morning. Can I just begin by asking, I think this would be a question for the Chief Executive. There was a parliamentary written answer yesterday indicating how many COVID-19 related calls you'd had since the 9th of March, and it was looked as though it was about 850 calls per week, online and telephone calls. Is that the kind of current rate at which calls are coming in? What's the rate at the moment?
No, calls spiked considerably during the first couple of weeks after the lockdown. So I think we've had, between the 9th of March and this last weekend, we'd had just over 7,000 calls and online inquiries about COVID taken together. But there was a real peak around the sort of 2 weeks just after the 23rd of March. And during that time, we saw the number of calls and online inquiries roughly double our normal rate. Until the various announcements about return to work, that had settled back to being more or less the same number of calls that we would have experienced in normal times, although about a third of them were still about COVID. So clearly the focus of people's interest had remained significantly on COVID-related matters. I checked in with the team handling calls and queries just this morning to see what difference had the various announcements yesterday and over the weekend had made. There was a small increase. There are roughly 60 additional email inquiries, and we kept the phone lines open late last night in case there was a flurry of inquiries. Actually, there were just 17 additional phone calls yesterday evening.
Okay, thank you. What is the regular rate at which calls come in normal times?
It's somewhere in the region. I mean, obviously it varies because the numbers are quite low, but low hundreds, less than 200 certainly normally a day.
Per day, yeah.
Yeah.
And so up till sort of last week, you're saying that it was running at that kind of rate?
That's right.
A third of them about COVID.
Yeah. It briefly doubled, but for only about 2 weeks, and then settled back down to total was roughly in line within normal times.
Yeah. Okay. Well, as you've mentioned, as the chairman mentioned as well, the government published advice yesterday, which I think has been quite widely welcomed, and that does make clear that employees who are unhappy or got concerns about conditions at their workplace, if they're returning, can raise concerns with HSE. So are you expecting a surge in calls as people start to go back from tomorrow?
Yes, I think we are. We do expect that. I think, people will often respond clearly to key things that are happening in the media, and clearly it's a concerning time for many people. So we have made additional provision to be able to have more phone lines open, more phone operators. Normally we only have around 30 people available to answer our phone and first line email queries. But we've made arrangements to have excess capacity so that up to 200 people can be available to answer calls coming in. And we'll keep this under review. I don't want to make people work late into the evening if there's no need for it. Our normal call times would shut at 5 o'clock, but we have made arrangements to keep the phone lines open until 10 o'clock. And we'll do that certainly for the next few days and keep it under review. And we'll keep it open for those kind of hours for as long as there's a significant public requirement for those kind of times.
So have you brought in additional call centre capacity in order to do that, or?
Yes.
And have you been given additional resources to enable you to do that?
So as I believe was probably also announced yesterday, the government has indicated that we can draw down up to an additional £14 million in the current financial year in order to assist us to cope both with those kind of immediate inquiries, potentially if there's technical solutions that we want to consider to put in place, and also to bolster the Inspectorate capacity that we have to deal with this kind of concern.
Okay. The written answer yesterday also said that since the 9th of March, you'd had reports of 50 dangerous occurrences, 1,859 cases of occupational disease, 56 deaths to workers resulting from suspected COVID-19, but that no investigation has yet reached the stage of identifying the need for enforcement action, and no workplace had yet been shut down. I mean, how satisfied are you that, perhaps particularly in view of that announcement that you've just mentioned, that you do have the resources to do this job properly, and are you able to respond in a timely way to the reports that you're receiving?
Yeah, I think we have been responding in a timely way. To give you, and you'll forgive me, I think the figures I have been prepared because of this appearance, and so they're slightly more up to date. So the numbers are all slightly larger than in the PQ that was answered. But so, for example, we've had between, I think, the 9th of March and right up until the 7th of May, as I say, just over 7,000 calls and online queries. Of those, just over 4,800 were queries about a specific individual workplace. Many of those were able to be dealt with immediately, but there were 1,400 or so of those that needed to be referred on to inspectors, of which on further inquiries, the employer had already put satisfactory matters in place, or indeed had made the decision at that point to cease operating, so they were no longer working in 900 cases. In a further 321 cases, the inspector had a conversation and required the business to demonstrate that they had actually put something in place to make a difference. And that evidence was provided to us. We would not normally double check in 100% of cases that the changes have been made and that everybody was satisfied. But given that this is a new area with heightened concern, we've also been going back in each of those cases, not only to the employer, but also to the complainant, to verify with them that they consider the employer has made the relevant changes and that they're now satisfied. And that has, it's only at that stage where we say, okay, this case is closed. There are another 27 cases where we have written formally to businesses now requiring further improvements to be made, having not made adequate progress in the sort of the first conversations. And there are 127 cases which we weren't able to progress for reasons that vary, but primarily include that the complainant won't give us permission to disclose the fact they've made a complaint.
Right, okay, thank you. Just one more question from me, if I may, and this is a question to Professor Curran. I mean, I imagine at the moment you will be fielding quite a lot of questions requiring a scientific answer. What's the capacity of the science base at the moment to answer questions like that quickly and correctly?
If I can use an example of personal protective equipment where there's been quite a significant involvement from our technical people, we recognised very early on that we were going to need to deploy that resource to answer what could be some quite difficult questions. So we've actually deployed in total, I think, 21 full-time equivalent people onto that work, drawing them away from existing activities to ensure that we can provide that rapid response to inquiries coming throughout the system. In doing that, made sure that the people who were involved had the right technical knowledge, and that knowledge was being used in a priority way to answer the questions in the right order. So, for example, looking at some of the stock that's arrived at the Daventry supply depot to make sure that the PPE was suitable and sufficient to enter the GB supply chain, supporting inspector colleagues in answering questions that may arise from the concerns that Sarah's outlined. And of course, also supporting SAGE in my participation in SAGE, and also in some of the subgroups of SAGE, where we're providing some of the quite applied technical knowledge that we have access to that is relevant to this particular issue. So in relation to that expertise, I would say it's a mix of our personal protective equipment expertise, our human factors expertise, our statistical and epidemiological expertise, and indeed our medical expertise, all of which has hopefully been able to provide that applied view of some of the issues to supplement the traditional research science activities.
Okay, thank you very much. Sean Bailey to ask the next question.
Thank you, Chair. So my first question really is just, I think it'd be really helpful just to have sort of a clarification of how the responsibility is divided amongst different businesses for the enforcement of safe working practices, particularly in the context of the current coronavirus outbreak.
Shall I answer this? Okay, so I think it's first worth acknowledging that the actual detail of the regulations is quite complex. And so I think the key answer for individual employees and indeed for the employers is that each and every workplace has an obligation in law to put up information about health and safety, including who their individual enforcing body is. So what we're not going to do is expect individual workers to sort of wade their way through the regulations and figure out who's my enforcing body. And where anybody does get it wrong and rings us, we will find the right enforcing body for them and point them in the right direction, rather than simply saying this isn't for HSE. So we don't leave people hanging. But to give you the direct answer, the broad split is between higher risk, where HSE is the lead enforcing authority, and lower risk, where it's the local authority. And in general, I think if you think about most retail shops, their associated storerooms, and most offices being with local authorities, but higher risk enterprises such as laboratories, manufacturing establishments, offshore oil and gas refineries, those kind of things sit with HSE. As I say, that it's all set out in secondary legislation, and it actually is incredibly detailed and quite complex, which I think why it's the most useful answer is say there'll be a poster up in your place of work which tells you who it is.
That's really helpful. Just as a follow-up on that, in terms of the relationship that HSE has, particularly with the local authorities and enforcements for low risk categories, I mean, how does that work? Have you got quite a good sort of dialogue with local authorities? Do you have quite extensive stakeholder management there? I mean, how is there an information piece there that you have to help those local authorities when they come to do their enforcement of any sort of Worksafe practice breaches?
Yeah, we have a close liaison with local authorities. We have a local authority unit, and they maintain regular contact with all of the local authorities. We provide general guidance to them if we're changing anything or if we have anything new, we make sure that that's proactively shared with them. And of course, we're always willing to share our scientific and other resources, and we will support certainly a specialist investigation or something of that nature with our scientific team.
And would you say that on the whole, the approach to enforcement at that lower level, is it relatively uniform? There's no sort of regional variances depending on local authorities. On the whole, you find that there's a relatively uniform approach, would you say?
Well, I think all I can honestly say is that I've not had anything reported to me around concerns about variability or variation. I think it's inevitable because each local authority will actually, when it looks at the kind of businesses in its area, will have different priorities, different types of business, a different split between rural and urban and different considerations. So I'm sure that there is some variation and variability, but I suppose that in a sense that is also the sort of the purpose of allowing the sort of the national local split, because it means that local authorities can concentrate their resource on those areas which are seen to be most important to their own communities.
Okay, that's great. I just wanted to turn a little bit more towards the guidance now. And I suppose from HSC's perspective, are you happy that the guidance on the whole is relatively clear for businesses and employers to be following? I know you said that apart from the initial few weeks of the outbreak, you'd seen that spike at the beginning, but recently it seems to have leveled off with inquiries. I mean, would you say that the guidance on the whole is relatively clear, or have you noticed through your engagements externally that there may be some issues there?
So are you talking about the guidance that BEIS have just published? We were very, very closely engaged, as were the PHE, in helping BEIS to write that guidance, and they consulted widely with both business and unions in formulating that. And I think that guidance is very clear. I think the initial guidance about which businesses need to open and which businesses need to shut was actually also very clear. If you looked at the list, there was a clear list in regulation which said these businesses may remain open, these businesses may not remain open. I do think that there was then some confusion in the minds of the public to some extent, and I think this isn't, my view is it's not really a fault of the guidance, which was clear, but I think the sense of key workers and sort of key industry became a little bit confused in some minds, and certainly we had some concerns raised with us in the early stages that were along the lines of business X, which was actually one that was allowed to open, should be closed because it shouldn't be, because the people ringing in felt it shouldn't be open because it wasn't, for example, a hospital.
Okay.
Martin Temple wants to come in, I think, is it, Martin?
It was just a very brief point relating to the local authorities and consistency. We did actually ensure that the local authorities had the opportunity for the same briefing on social distancing, for example, that our own HSE people had. So that was specifically devised by ourselves to get as much conformity as we could on this.
And Martin, just to follow up on that, have you found on the whole then that the conformity's been relatively good, particularly around that sort of social distancing briefing?
I've got to answer in the same way as Sarah, actually, and that is I'm not aware of anything.
Okay.
But with such a variety across the country in different circumstances, it would be unusual if there weren't some degree of variation, but we're not aware of it.
Okay, that's fine. Thank you for that. I just one final point I want to touch on, which is just around the self-employed, and whether or not you felt that, as regards to self-employed, that they were relatively sort of properly protected during this outbreak in terms of following the correct regulations, and also more widely how you regulate the self-employed and any sort of contact that you may have with self-employed people to ensure that they're up to date on the relevant guidance and regulations as they try to sort of carry on with their work.
So again, I suppose you fairly quickly get into some quite complex area depending on which kind of self-employed person you're talking about. So for example, many individual people in the construction industry will be in fact self-employed contractors, and where they're working on a construction site, then under the CDM regulations, the overall lead contractor will have an obligation to everybody on that site, irrespective of the fact that they're not directly employing them. So what our general view with self-employed people is, and the law applies obviously differently to the self-employed than it does to the employed, but we would still provide guidance to them, provide the same degree of help and assistance to enable them to choose to keep themselves safe. And of course, where a self-employed person is carrying out work activities that could impact on others, then they're also under legal obligations to ensure that their work activity doesn't impair the safety of those with whom they come into contact in a working context.
And I think you've sort of touched on it, Sarah, a bit, but from an enforcement piece, if you have got, obviously someone that's self-employed that isn't necessarily following those regulations, how would you enforce that? I mean, would I assume that would fall on the local authority to a degree to ensure that a self-employed person within their patch was following through the regulations and was conducting themselves properly. But from an enforcement piece, is that quite difficult, would you say?
Well, it depends on the industry that they're working in. Actually, many self-employed people do come under our own enforcement regime rather than the local authorities. So if you think of self-employed, as I mentioned, the construction trades, another significant group of self-employed people who would be regulated by us would be, for example, farmers, where they're self-employed. And unfortunately, some of the highest fatalities are within the farming community. And so when we think about potentially a prosecution, you need to balance the public interest as well as the interest in enforcement. And it is also true that where, for example, a self-employed individual has unfortunately done something which has resulted in their own death or serious injury, it's not always appropriate to then continue with criminal proceedings or other proceedings against them. And so these cases just need to be weighed up on a kind of case-by-case basis, taking sort of account of what would be gained in enforcement action and thinking about wider protections and the importance of health and safety being followed properly and the sort of message that goes on to others, but also thinking about, potentially a very seriously injured individual and or the bereaved family.
Can I just bring Neil Coyle in? I think you had a question to raise here before we move on. Neil.
Yeah, just a quick one. You mentioned the new guidance, which it's great to see the government's work with trade unions and employers on, but the concern seems to be about having the time to implement the new guidance before people are expected back at work. So could you talk us through that? Do you think employers and businesses have the time to ensure safety for employees and their workforce?
Well, I think first of all, although I think it's very helpful that the guidance has been set out in this kind of sort of detail, of course, at the moment, it's only aimed at those businesses actually which were already enabled to be open, and where individual businesses have been approaching us during this period, we've been able to provide the same kind of advice in the background. And obviously what is considerably above, I guess, all of the witnesses here this morning's pay grade is any decisions about return to work.
So you're saying that the guidance that's been published, you should already have been doing. You should have already made that available to public, and there's nothing new. Is that really what you're saying?
No. What I'm saying is that the businesses that is aimed at were currently all able to be open, and then what we've done is by pulling those individual different things to think about if you have been in a period of not working, is putting it in one place and letting people see that all in one place and gathered together for the different industries that are covered by the guidance there.
Okay, thank you. Ben Spencer.
Hi, thank you. So how do Public Health England and the HSE work together, and where do their responsibilities lie?
Perhaps Professor Simpson could start off.
Yeah.
That one.
For the way we work, PHE and HSE have an ongoing relationship because there's quite a lot of fields where we interact. I mean, particularly one would be the way that HSE does the enforcement on our labs, for instance. In working with this is that we have been in fairly constant contact with HSE, particularly over the last few weeks, about the guidance, about the the Bayes documents, where we've worked very closely in feeding in on that. PHE's basic role is to provide the public health and scientific advice on which people can base the guidance. So we advise on the scientific basis with SAGE on things like social distancing, on the fact that actually with this virus, hand washing and behaviours like that are much more important than some other behaviours, and what's important and what's not, particularly when with health and safety and safety of the public and health and safety in particular. This is basically a set of systems which you use to reduce risk, and so the advice we give is the scientific advice, and then our HSE colleagues can put that into practical guidance.
I think Professor Curran wants to come in, and then I'll go back to Ben. Professor Curran.
Yeah, I just wanted to support what's just been said, really, because over the last few weeks, there's been considerable work between PHE and HSE to jointly consider and develop information that enables people to understand some of the scientific issues around COVID-19. And our experts have been working together in a variety of different ways, be it looking at PPE, looking at the reuse of PPE, for example, to make sure that the best scientific evidence is applied to these difficult questions. And also, as was mentioned, the collaboration across some of the SAGE activities, be it to SAGE itself or some of the SAGE subgroups, is really quite important, I think, because the knowledge that resides both in PHE and in HSE from a technical perspective is really quite important to help us understand some of the practical applications that would need to be considered when enabling people to get back to work. So I would say that collaboration has been both effective and important in ensuring that the evidence base that's being used to advise people what to do is appropriate and based on the real world of work.
Thank you. Ben.
Thank you. And following up on that, so just explain to me, how is that applied in terms of, let's say, high risk settings? So the most obvious one would be NHS hospitals, but of course we now know there's a variety of different high risk settings, such as care and nursing homes. What's the relationship and who calls the shots in a sense in terms of the guidance and advice in hospitals on COVID wards, for example, and the use of PPE in those settings?
Professor Simpson.
Yeah, from a PHE point of view, what we do there is that we will give the scientific and public health advice on, and also on some of the technical advice on what PPE is there and what works. And obviously, we're all from a health background, PHE, so I have quite a lot of knowledge of the way the health systems work. But PHE is not an enforcement body. We can advise and we can provide input and guidance, but what we can't do is enforce.
And so that responsibility lies with HSE in terms of the hospital settings, because I mean, I've had lots of constituents, as I'm sure we all have, contact us about PPE in hospital settings and how that's working. And we all know that the use of PPE guidance has changed over the last few months as the scientific evidence has evolved. Whereas what's the enforcement, again, who's the decision makers around that, and what are the tiers of enforcement to ensure our doctors, nurses, domestics, all healthcare staff, and also particularly the most vulnerable groups, which we're now starting to understand, the BME population, people who are older, have adequate advice and protections at work?
Let's take Professor Curran first and then Martin Temple.
Shall I come in and just talk about the science? So absolutely right. The PPE issue is very important in this setting, clearly. And we as HSE over many years have developed some appropriate guidance for PPE, which has been deployed in the case of COVID-19, particularly in those areas where aerosols might be generated, because that's clearly one of the most high risk activities. So very early on, we looked at the protection issues provided by different kinds of PPE. We did some quite rapid evidence reviews to ensure that the personal protective equipment that was available was appropriate for the job in hand, i.e. to protect those individuals who may be exposed to aerosol generating procedures. We've been working with colleagues in PHE to look at issues around reuse of gowns, for example, and other personal protective equipment to make sure that it's appropriate, that it maintains safety, and that there is the evidence base to do that. So we have been working really hard to ensure that the evidence base keeps up with the requirements as the situation develops. I'll perhaps pass it to Martin or Sarah to talk about the enforcement side, but the science has been critical in underpinning our understanding of what actually works and to ensure that the personal protective equipment actually protects the person who wears it.
Let's take Martin and then Chris Stevens, I think, wanted to come in. Martin.
Yes, in terms of the regulatory responsibilities, in England, HSE is responsible for the staff, CQC is responsible for the patients. Sarah may want to come in on this later, but in Scotland, we're responsible, for example, for the patients and the staff. So there are different responsibilities in the different parts of of Great Britain. And then, of course, there are slightly sub-responsibilities around some of the aspects of medical appliances and PPE. But I don't know whether Sarah wants to add any more to that. But specifically in answer to Dr. Spencer, those are where the main regulatory responsibilities lie.
Can I just ask, we all heard about the Turkish PPE, which was rejected as not suitable for use in the UK. Was that HSE deciding that, or was that somebody else?
Andrew should probably answer that one.
Yes, so we do have HSE staff on the ground at Daventry where a lot of the PPE is delivered, and indeed the Turkish gowns were delivered, I think, to the Daventry depot for us to have a look at. Our people on the ground collect all of the information that's provided with the kit as it arrives to that depot, and they review it to make sure that, for example, the certification is appropriate, that it's genuine, because we are seeing a lot of fake certification, that the certificates actually relate to the materials that have been delivered. And then they make a recommendation to our decision-making group, which comprises myself from the science side, our chief medical advisor from the medical side, and one of our senior regulatory colleagues to ensure that any agreement to enable that PPE to enter the GB supply chain is based on its ability to protect the people who are going to wear it. And in the case of some of the Turkish gowns, our recommendation was that the gowns would need to be subjected to additional testing before we were able to allow them to enter the GB supply chain, because there wasn't sufficient evidence provided at the time to enable us to be assured that they would protect the people who were going to be wearing them on the front line.
Right, so that was an HSE recommendation, that one. Chris Stevens. Chris, I think you indicated no. Sorry. Okay, I beg your pardon. Ben, is there anything else?
Yes. So one last question, just unpacking a bit. What it's been discussing, based on what we're learning about the epidemiology of coronavirus and how it looks on the early data to be disproportionately affecting different groups. Are you intending to update guidance accordingly in terms of safety at work? So raising the risk factors that I've just mentioned.
I think that's probably one for Sarah, is it?
I'm happy to. Am I unmuted? Yeah. Well, we keep the guidance under constant review, and I think it's something that, as that evidence increases, it's something that we would probably want to look to colleagues both in PHE and our own scientists that Andrew leads to give us advice on that. But I think certainly to the extent that there is evidence that a particular group of people, and clearly there have been indications, haven't there, around not just age but also ethnicity, we would want to consider whether different degrees of protection are required. But I think we would always want to be led by the science and actually be looking at ensuring that people are exposed minimally to the risk in their various workplaces. And Andrew, I don't know I think I saw you wave your hand
I'll take Professor Curran and then Professor Simpson, I know wants to come in as well. Professor Curran first, very briefly, if you would.
Yes, the evidence base is evolving all the time. I think that's the first point, and we need to be absolutely sure that the evidence that we use to make decisions is appropriate, because sometimes when evidence is evolving in this way, early findings don't always follow through into a robust finding. So I think we need to just make sure that we use the right evidence to make our decision.
Professor Simpson?
Sorry, very similar point is that we're looking at our own data and our colleagues' data internationally all the time. And sometimes these signals are real, sometimes they're not. And it's important we do make sure that the signals that have to go through into policy are the right ones.
Thank you very much. Nigel Mills.
Thank you. Can I just start with a pretty blunt question, but all the panel's clear view is that it is safe for the 31 million or so people who work in this country to go back to work unless they're in a activity that is specifically closed by the government. That is the view, that every workplace can be made safe. Is that correct?
Sarah?
So I think our view is that every workplace should do a risk assessment, that the vast majority of them should be capable of implementing social distancing and appropriate hygiene and the other best lines of defence that are set out in the guidance. But if an individual employer concludes that the particular issues around the way they work or their accommodation or their staff means that they can't, then they should individually not open. So we're not, I think the whole of health and safety legislation and the way it works in the UK is the primary duty is on the employer, the duty holder, to consider all of the risks in their workplace, not just COVID, but all of the risks. In the case of COVID, they need to think about the additional risks that COVID places on them and their workforce. They need to think about how any additional controls that they might put in place would interface with other controls that they already have in place to maintain health and safety in their workforce. And they need to reach a conclusion about whether or not they can safely continue and can carry on. But our expectation would be that the vast majority of workplaces would find it possible and practical to implement the kind of social distancing and hygiene regimes that are set out in the guidance.
So for our constituents that are nervous about returning to work, the message would be your employer, if they take the steps they should take, it is safe for you to go back. That is the general message we're giving.
Yeah, I think that's right. A risk assessment done properly with the right steps put in place should enable people to have confidence that their workplace is safe for them to return and to work.
Okay, can I just look at some of the mitigations? Because I think the guidance that's been published says that employees must maintain social distancing in the workplace wherever possible. It doesn't say at all times. And if they can't maintain the social distancing, then they have to take mitigating actions. That's the correct understanding I've got there, isn't it?
Yeah, I mean, it may be that John or Andrew would like to come in with some of the science around this, because it isn't as if there's a sort of bright shield of 2 meters that's around everybody, and if ever that's breached, then you're unsafe, and as long as it's in place, then you're definitely safe. The social distancing guidelines is really looking at the principal methods by which the virus is spread, and that's primarily through droplets going onto surfaces and then people sort of touching them and spreading them. But obviously in medical surroundings, the direct aerosol generation is a serious issue as well. So hygiene is incredibly, incredibly important. The ability for people to wash their hands, employers reminding their employees the importance of that basic hand hygiene, not touching your face after you may have touched a dirty surface, and all of those things taken together. And one of the things that an employer needs to think about is the amount of time that you may be exposed to another individual within a sort of 2 meter gap. So it's not as straightforward as simply saying 2 meters always fine, breach 2 meters as an immediate problem. But as I say, John or Andrew may want to say a little bit more about the science and evidence around the safe working rules.
It's a really, really important point. And I think the first thing I would say is, as Sarah's indicated, there are 3 major transmission routes: from surfaces, from the air, and from people. And when organisations are considering their risk assessment, that's clearly where they should focus. The 2 metre rule, as Sarah says, is not sort of like an immediate. Once you go below 2 metres, that's it. It's a very dangerous situation. It's a function of both distance and duration. So yes, the risk will increase as you get closer to someone, but if you're close to somebody for a short period of time, then you can manage that risk. Similarly, the orientation between people is quite important. So there's a big difference between 2 people facing each other and 2 people with their backs to each other. So there are things that you can do in some situations which, if the exposure is going to be for a short period of time, less than 2 metres, you can manage the risk in the context of that duration issue and orientation issue. So I think for me, the most important thing...
How short is short? Professor Conrad, how short is short? How short period to be safe?
There is some physics in this, and the SAGE subgroup on environmental modelling is looking at this to provide perhaps some better information for people. But for example, I think if you were exposed for, let's say, a few seconds at a metre, that's probably about the same as being exposed for, let's say, a longer period of time, an hour, say, at 2 metres. It's that kind of order of magnitude. So it therefore is important that people understand the work activities that comprise a whole job, because there may be elements within a job where that exposure is for a short period of time, where actually the risk is so low that it can be managed effectively just by using, common sense and a better understanding of how that transmission might progress.
Professor Simpson, did I see that you were indicating?
Yes, thanks. Andrew said most of what I was going to say is that there is a duration and a distance element to the exposure, and that really has to be worked through. 2 metres is not a magical number. We know 2 metres is a very safe number. Some other countries, Germany, for instance, says 1.522, although they're beginning to go more towards 2. But 2 metres is a good distance. The other thing, just from a behavioural science point of view, is 2 metres is actually a very good distance for everyone to think about, because it's basically the length of the distance of somebody, if it was somebody lying down between you and the next person. So it has quite a good behavioural science backing to it, apart from being safe from a scientific point of view.
Nigel.
Is it fair to say that this is about managing risk? And I think I have some constituents who think if we just waited another couple of weeks or another month before we reopen workplaces, that it would be much safer. Is it basically fair to say that's not accurate? That we're going to have to learn how to manage the risk of living and working with COVID-19 for a decent amount of time, and then just have to accept there is some risk in being at work, but that risk is pretty low.
Yes. If it's okay, Chairman. Yeah, I think that is a very good point. And until we have an effective vaccine for this organism, and we have more knowledge of how good and how long-lasting the immunity that being affected by this organism is, then in a sense we are going to have to live with with dealing with this organism, dealing with how we reduce transmission, because the rates are going down. We hope that we can keep it that way until we have a vaccine, but otherwise then there's always going to be an amount of balancing of risks that people are going to have to be able to cope with.
Could you just quantify the current risk? I mean, of the 31 million or so people who work or are self-employed, how many roughly do you think currently have the virus in that kind of age and working group? Is it more or less than 1% of them? Is there an estimate for these things that you have?
Yeah, I think the view at the moment would be probably about 0.25%.
Oh, right. So if I've got a factory of 1,000 people there may be 2.5 people in theory who have got that, who shouldn't be coming to work. That's roughly what you're saying.
I think that would be of people who are asymptomatic, and you have to remember that one of the biggest rules is that if people are symptomatic, they shouldn't be going to work. They should be staying at home, and it's very, very important that that is stressed. Because that is very important. There is some asymptomatic transmission, but it's not the major component.
As a final question, should employers be doing temperature checks?
Basically, temperature checking for people going into work is probably rather ineffective. There is good science on this, and there's science on it, particularly on airports. Interestingly, anecdotally, I suppose I shouldn't do anecdote, but talking to one or two very large companies, which I've done recently, who have done this, have said they find it very useful for reassuring staff, but actually they don't find anybody on it, and these are large firms. It's not scientifically, it's not a very good intervention. But some companies have done it, and they seem to now realise that it might help in staff reassurance, although it may be slightly false reassurance.
Okay, thank you.
Thank you very much. Steve McCabe.
Thank you. I want to ask about the question of advice and guidance for pregnant women in the workplace. I have to say I am honestly really quite confused about this. I noticed that the charity Work and Families say they've received calls from pregnant women whose employers are insisting they come into work. And I've certainly had calls to my own office, one from a woman who worked on the front line in a care home, who was told that she must come to work. Now, at the Select Committee on the 23rd of April, the Employment Minister told me that the situation wasn't clear enough, and she was waiting for BAYS to work with WP to provide an update. And then last week, the Health Secretary told me during a statement that he was perfectly satisfied with the existing advice and guidance. What is the position? Is the guidance relating to pregnant women in the workplace clear enough?
So,
Sarah.
So I believe that John may want to come in on this around the sort of the evidence for vulnerability of pregnant workers, but I think the guidance does not automatically designate all pregnant women as being in the shielded category, which is the only category where people were asked to stay at home and remain at home. And I guess the complexity here is around the additional employment rights that are available, obviously, to women who are pregnant. And so an employer needs to conduct a risk assessment, and they need to think about, in conducting that risk assessment, clearly the working arrangements and the type of work that's going to occur, the individual woman's pregnancy, and also any other health conditions that she may have. So whereas pregnancy alone won't put you into the category of shielded and advised to stay at home, potentially if you have other health issues at the same time as pregnancy, then you may be in a shielded category. For those employers who then cannot put appropriate measures in order to satisfy their own risk assessment that the pregnant worker will be safe in the workplace, then they're required under the regulations that provide normal protection for pregnant women in the workplace to suspend them on full pay in line with the Management of Health and Safety at Work regulations.
So not to send them home on sick pay or to tell them to take unpaid leave?
They can't make them take unpaid leave if their pregnancy is part of the the reason why they are not safe to be in the workplace.
And what should happen where employers are doing that?
Well, I think the individual woman's right of appeal would be ultimately to an employment tribunal.
Okay. Can I just? Did you want to add something? Sorry,
Professor Simpson, did you want to comment on this?
No, I think Sarah's covered it. I mean, I'm not an expert on the employment rights of pregnant women, but that certainly should not change in this. The one bit of good guidance, one bit of science we can give you is that we know that this virus doesn't cross the placenta and doesn't cause there's no reason to think it would cause congenital abnormalities. So from that point of view, that's probably the one most relevant bit of science, apart from obviously the normal advice for pregnant women.
Steve.
But I just want to be clear about that. So we're saying there's no risk to the pregnancy or to the baby. Is there a risk to the woman?
Well, there would be the risk of getting coronavirus. We don't have evidence that at the moment, and I'll go back and check that pregnant women are more likely to become seriously ill with this virus. I've not seen any evidence on that. However, there are all sorts of reasons, as Sarah says, in employment legislation for where pregnant women have protections. But there is no. I don't think there is any evidence that being pregnant will make you more likely to have severe illness with this virus.
Okay, thank you. Now, look, the reason why I pursue that is, and this is in relation to the point that Sarah made about a health and safety assessment. A constituent of mine who works in a care home, the woman who is pregnant and was told she must come to work, she does a frontline job in a care home. She was told that her employer had conducted a health and safety assessment and concluded that there was minimum risk. Now, obviously, given what's happening in care homes up and down the country, I find that quite astonishing. Can you tell me, who is responsible for regulating these assessments? How do we know that it was properly conducted and that the conclusion that there was minimum risk was accurate? Is that a health and safety exec requirement, or which body pursues that?
So ultimately, there's no requirement that risk assessments are lodged and approved, and I suppose that takes us back to the question that I covered earlier, that the fundamental obligation to ensure that the health and safety is maintained in a work environment lies with the duty holder, the employer. However, yes, it would be the HSE typically who would be the enforcing authority, and if your constituent or indeed anybody in that circumstance had reason to be concerned that there was an inadequate risk assessment, or that the employer was not doing the right thing, then they could certainly raise a concern with us, and we would look into that and we would take regulatory action if appropriate.
Have you looked at any health and safety assessments in care homes in recent weeks?
I'm sorry, I don't have the details of the particular types of queries that have been raised with us, but I could certainly find that out, and I'd need to write to you.
Well, that would be helpful. Thank you.
Okay, thank you. Just worth perhaps making the point, I think the guidance published yesterday did make clear that new risk assessments need to be undertaken to take account of COVID-19, and that if there are more than 50 staff involved, those risk assessments must be published. So that's Sarah.
Sorry, and I realise that I've been talking potentially grouping things together and sort of using care homes in a bit of a vernacular sense. So technically, care homes are split into nursing homes where more vulnerable patients are typically looked after, and care homes, which could just be residents for elderly people who aren't any longer able to sort of, cook and clean and do those kind of things. And that lower grade care home will be under a local authority enforcement regime, and the nursing home type environment would be HSE. And I realise I've been perhaps using slightly too loose language, and I just didn't want to mislead the committee.
Very helpful. Thank you very much. Celine Saxby.
Thank you. I wanted to ask about public awareness with HSE, and wondered what have been done to increase public awareness of your role and how concerns can be reported given the increased safety risks at work and as a result of this outbreak. And I just wondered, how confident are you that people know what you do?
So I think we've been doing quite a lot since lockdown, 23rd of March. You would expect us to be monitoring in this day and age what's happening in the social media space. And I can tell you that the campaign activity we've been running since then has reached in excess of 10.8 million people in different social media regimes. That relates to different output engagement that people have had with our messages and things like that. Our COVID-19 microsite, which I think Martin referenced at the beginning of this session, has now received in excess of 1.8 million page views, which has been almost 20% of our web traffic since the 20th of March. And the main COVID-19 landing page has itself received 940,000 page views, ranking above our current organisation's homepage. So I think, we've launched a new form, new helpline. As I said, in the first couple of weeks of lockdown, we saw the numbers of phone calls and emails that were reaching our various helplines double. So I'm relatively confident that people do know that we're there and do and can reach out to us and are reading the information that we're putting out.
And sort of building on that, just wondering about the sort of relationship between yourself and other bodies, because the website, obviously your website, sets out the types of businesses that you're responsible for and those that fall under local authorities. And so somewhere like I am in North Devon, our local authority is tiny and is currently inundated with concerns about 1,000 tourists arriving this weekend and not having opened any of their public toilets or car parks. And so if they're getting concerns that should be with you and vice versa, is there a good sort of communication line between the two? And also, are you providing that advice down to small local authorities who are perhaps experiencing things they've never experienced before?
Yeah, I mean, certainly we're sharing best practice with our local authorities through our local authority unit, and we've got a well-established sort of communication channels between us and the various local authorities. We're proactive in if we're changing something or doing something different in sharing that. As I said, if people come to us when actually their detailed concern is for something about an individual local authority, we will try to find out for them which local authority it is and put them in touch with the right place, the right team, because I think we all appreciate how incredibly frustrating it is when you ring or make contact and just get passed from pillar to post and people just keep saying, oh, it's not me, but they never tell you who it actually is. So we do try to be more helpful than that and to point people in the right direction, in the right place. And indeed, many of the queries that we get aren't about necessarily just a specific workplace, but are a more general, what are the, my employer's obligations, what kind of things do I need to do? And we're able to answer a large number of general queries without drilling down into sort of where people live and trying to make them speak to local authorities instead.
And is there a process to sort of compile all of these coronavirus workplace safety concerns that are reported to yourselves, local authorities and other enforcing agencies, so that there is a full picture of what's actually going on in our workplaces with relationship to the coronavirus?
As far as I'm aware, there isn't a central place of gathering all of the different concerns into just one data set. I may stand to be corrected by my stats team, but I don't think we do routinely compile all of the different concerns that are raised. What, of course, we do get to see a national picture of ultimately are those riddle reports where people are reporting an incident, accident, or indeed a fatality under the riddle regulations, which may have us or may have a local authority as the enforcing regulation. And those statistics can be compiled on a whole picture basis, as well as looking at the individual enforcement authorities.
Thank you very much.
Thank you very much indeed. Chris Stevens.
Yes, thanks very much, Chair. I just want to pick up on some of the issues that came about in your introduction, Chair, if I can, in terms of enforcement powers and the resources issue. So just to ask firstly, I think it was said to the Chair that there had been 5,000 concerns raised at the start of the COVID outbreak. So just to ask again, what proportion was investigated, and how is that different from what would be a normal period? I think Sarah wants to come in. Sarah, sorry.
Martin, would you like me to take that? So of the concerns, we consider all of them. So we go through a process of each and every concern that comes into us, whether it's COVID or non-COVID, looking at that concern, understanding what the issue is, whether or not it's something that is of the type of query that we can deal with. So I mentioned, for example, a typical concern on COVID where we would have said to the complainant, there's nothing we can do, would have been people who were ringing us to say the building site opposite me is working and they're doing something, they're building something that isn't an essential building, and so they shouldn't be open at the moment. The government guidelines never required building sites in England to shut. There was obviously different in different countries in the United Kingdom, but in England there was never a requirement. And so our call centre workers would have logged that, but they would have been explaining to the individual that those businesses were allowed to remain open and that we had no jurisdiction to prevent them from being open. For things where businesses where people are raising a sort of concern about their specific workplace, our team would engage with the complaint and understand whether or not in principle it's the kind of thing where we may take enforcement action. They'd be then making contact with the employer to put that complaint to them and ask for any evidence that they had around what the current situation was. And if they said that everything was fine, we would ask for evidence to see that. And if it appeared to the inspector dealing with that complaint that everything did look fine, we'd be going back then to the individual complainant to just say, we've seen X, Y, Z. It appears your employer has either sorted it out or it's working okay now. Do you accept this? And are you happy for us to close the complaint? So everything is followed up. It is, as I said, only a relatively small number of cases where of that number that we were talking about at the beginning, the sort of nearly 5,000, where we are still in a position where we've had to write formally to the business requiring them to make changes that they otherwise were not proposing to do. And I think that talking, John said earlier that we shouldn't use anecdote, and maybe we shouldn't, but I think in this case it's quite informative. The sense that I'm getting back from our inspectors is that the heightened awareness around COVID in particular as a risk in the workplace is making employers really quite amenable on the whole to making changes, and they are seeing people who want to do the right thing. And in that sense, it's perhaps more similar to, say, for example, asbestos, where there's really widespread public understanding of the risk involved in working unsafely with asbestos. And it's not normally hard for us to get compliance in the majority of cases where that's raised as an issue. Compare that, for example, with some of the other things which can be really significantly problematic, like working in a hole that's been dug that doesn't have adequate support, or working at height without adequate protection. People sometimes don't necessarily appreciate the risks and take those quite as seriously. But I think COVID has really been in a class where people have been responding very well to the intervention of our inspectors and our other staff to require changes to be made.
So just to help us understand then, Sarah, in terms of what you're facing now and what you would face in a normal period, how many additional complaints? I think I'm just trying to get I think as a committee we would want to know the difference between what's happening now currently and what would be a normal period in terms of the volume of complaints you'd be receiving.
So right now, in terms of the volume of complaints, as I think I said to the chair at the beginning, It's settled back down so that we're seeing roughly the same number of complaints that we would normally receive, but they're skewed towards COVID. So we had a period for a couple of weeks around the lockdown where the numbers, if total complaints, roughly doubled. But right at the moment, we're getting more or less the same number of complaints that we normally do, but roughly 30% of those are about COVID. But it isn't just complaints, and I think it is important that the committee understand that, notwithstanding the fact that COVID is clearly uppermost in everybody's mind about sort of this big new and really important risk for employers to take seriously. And, you know, we have had somewhere in the region of now 200 nearly RIDDOR reports of dangerous occurrences for COVID, over 3,000 RIDDOR reports of occupational disease, and unfortunately 71 deaths of workers reported to us under RIDDOR. People are unfortunately dying in those industries which are open for reasons that have got nothing to do with COVID. And in the period since the 23rd of March, we've had another 38 people killed at work, unconnected with COVID, including 3 people killed gas as the reason. But, you know, we've seen farmers crushed by their animals, people falling from height, people killed when vehicles drive into them, and, you know, all of the normal tragic reasons why people unfortunately are still killed at work. And so it's really important, I think, to understand that our inspectors are taking both COVID and non-COVID deaths and other accidents and incidents absolutely seriously, as we always would, and are prioritising investigating those in the way that the committee would expect.
So I would say, it would seem to me, just one of the issues you touched on was working at height issues, which I think the committee have had some evidence sent to us. So that seems to be a concern. I think it's something that we'd want to maybe continue to pick up, excuse me, with HSE. But I think, Sarah, if I can take you back to what you said to the chair, I think some of us would be alarmed that no business has been enforced to close down since the COVID outbreak. Is there I think we would want to try and find out the reason for that. I mean, obviously we know that there are rogue employers out there that are forcing people, or trying to force people into work. So could you maybe give us a reason or an explanation as to why HSE have not enforced a closure of any business?
So, I mean, to prohibit a business, prohibition notice under the Health and Safety at Work Act effectively requires an inspector to consider that there is an immediate risk of serious personal injury. So to conclude that you are likely to have a serious personal injury so that you are likely to contract COVID, I think, first of all, you've got to think about the general likelihood of contracting COVID at all and its prevalence in the general population. So I think, first of all, to sort of get into that sort of, this is a highly likely thing to occur, you're probably going to be restricted to those work environments where COVID is particularly prevalent, such as intensive care units, some nursing homes, those kind of areas. And then you'd have to see the risks that have been implemented in order to protect the workers in that to be so significantly short of what was acceptable that you concluded that they were in that really imminent risk of serious harm as a result of the working practices. And I think, you know, it's for all of the difficulties that have been well documented that the NHS faced, particularly during the peak of this, where there were clearly serious pressures and real concerns about availability of PPE and those kind of things, we haven't, to my mind, seen such an uncontrolled and unacceptable environment that we would feel the need to sort of step in and say, this intensive care unit is so dangerous, it cannot continue. And I imagine that you wouldn't expect that the NHS would have been run in such a way that we would have been in that position. But so I think understanding that sort of limit on prohibition, what of course we can do, and our inspectors have been doing and continue to do, is to work with businesses to require them to take the reasonable steps that they need to take in order to implement social distancing and the other hygiene related issues that will give that kind of protection to their workforce and require them to do that in order that they can continue to work safely.
So maybe then, Sarah, if we take out health or care home, if HSE got a complaint from a worker that there was no PPE, there was no social distancing, none of that was happening, what enforcement action in those circumstances would HSE want to take? Because I'm trying to get people watching, some sort of explanation, because obviously people will be concerned that no businesses have closed.
Yeah, I mean, what our inspectors would be doing, I think we need to be careful around PPE. I mean, clearly PPE is an important last line of protection in a number of work environments, and certainly we've been working with industry to remind them that, if they need PPE for their normal work, they need to be able to ensure that they have sufficient supplies of that, for example, to protect against dust and other things, given the shortage there's been of sort of PPE generally. So it remains important that if that's part of your overall risk assessment as a business considering reopening, you ensure that's available. But thinking about social distancing and those kind of things, what we can and will do is work with individual businesses to require them to change the way they work in order to put in place the appropriate kinds of social distancing, hand hygiene and those other routines in order that their workers can have the protection and confidence that they need to return to work.
So what other enforcement?
Chris, can I just bring in Martin Temple? Wanted to comment, I think, before coming back.
Yeah, sure, of course.
Sorry. I think really just to enforce something or reinforce something Sarah said earlier, and when you've asked about closing businesses down, I think she mentioned early on in her statistics that actually, when approached, a number of employers did actually choose to stop operating themselves when it was made clear to them that their methodology of operating at the time wasn't safe. So such a business just wouldn't be allowed to continue. It's just that in many cases they've realised that it just wasn't possible to continue. And I think that was mentioned earlier. So I wouldn't like you to get the impression that just nobody stopped working as a consequence of finding the social distancing, etc., difficult to achieve.
Thank you.
Well, I think that's, Martin, I think that's very helpful. Would you have sorry, Martin, I think that's very helpful. Would you have statistics in terms of the numbers of how many businesses have chosen to close as a result of HSE contact? Would that be available?
We would have the numbers of businesses which had closed between there being a complaint made to us and us then following it up. I don't know that we would necessarily have evidence in every single one of those that was a decision that they made entirely because of a complaint coming to us, or indeed that they'd made that decision because of social distancing or other things rather than just the sort of economic viability of continuing work. So I think we have the data on that they have closed rather than why they have closed.
I think we'd like to see that. Yeah. If you could send that to us, that'd be very helpful.
Happy to do that.
Thank you.
Yeah, I think that would be helpful. Thanks, Chair. So just moving on then, the additional funding.
Last point, if you would.
Oh, last point then. Sorry, I apologise. Has there been any work that the HSE have been unable to do as a result of resources issues? And is the additional money coming in going to assist with that?
So there's no specific task that we have wanted to do, and we've sat and said, well, we just can't do it because we can't afford it. I think clearly all organisations, and we are no different, would do more things if more money was available. So, undoubtedly, with a different overall financial settlement, there would be different amounts of work we would do, different things we would have chosen to do, but there's nothing specific that I would want to say to the committee or indeed to those departments who give us funding that because of a lack of XYZ, we're not doing ABC. I think that the additional money is likely to be certainly helpful in meeting short-term peaks and thinking about how we can bolster some of these teams who are providing initial advice and contact to members of the public who are getting in touch. the funding that's been made available so far, as I guess you'd expect in a crisis like this, is short-term funding. And we will need to engage, as will the rest of the public sector, in a sort of longer-term spending review if, for example, this particular crisis looks like it's going to have a long-term impact on our overall activity and require us to up the amount of investigation and other resource devoted to COVID, because I think in a short term we are used to flexing the resource available to the most pressing and current concern. But at the moment, for example, roughly 30% of the queries and concerns coming into us are about COVID. If as the entirety of the workforce comes back to work and normal queries and complaints go back to a normal level, if they do, if we saw, say, a 30% increase in workload, then obviously we would need to talk to those that fund us about how we would manage within that increased work.
Okay, fine. Thank you very much. Sarah, can I just ask you to clarify one figure? The written answer yesterday said HSE has received 6,780 calls and online inquiries between the 9th of March 2020 and the 4th of May. I think you had an updated figure.
Yes, so also 9th of March to the 7th of May, the same figure would be 7,149.
To the 7th of May. Thank you very much. That's very helpful. So Desmond Swain.
So Sarah, am I one of Chris's rogues forcing people back to work?
Well, I don't know what you're doing.
Well, I'll tell you, the illusion that got abroad that somehow it was only essential work that should continue led to a huge number of people coming to me for my advice with respect to small builders, gas fitters who go into people's homes to change the boiler, gardeners, window cleaners, even mobile dog groomers, to which my advice was, yes, get back to work, get out there, just show some social distancing with your clients. So are we making too elaborate a science of what is actually largely common sense?
I'll take Martin Temple first. Martin.
We are on this. It is quite clear that the general guidance has been for people who can work at home should work at home, and employers should facilitate it wherever possible for them to do so. After that, and some of the essential workers words and all that have been not really in the government guidance. They've been used where the press has tended to broaden it or make other definitions. So if you can't work at home, and then you can go to work and work in a sensible, socially distancing way, all the things we've discussed this morning, then the general view is you should go to work. And we've seen more over the last day or so on how that's been clarified about how people should take care when traveling to work or not to work. But if people can do appropriate social distancing at work, then they should do so, other than those areas that have been quite clearly designated as not to be open for work. For example, we've seen it shops, restaurant, pubs, those sort of areas that have already been designated as such. And we do recognise that in certain circumstances, probably fairly rare, and Sarah touched on it earlier, that social distancing in the way that we've discussed today may not be possible or not be appropriate, and in which case one has regrettably got to say those are some of the probably relatively few areas that cannot continue working still. But by and large, if you can't work from home, but you can do it in a socially responsible way, as we've defined earlier, then people could and probably should go to work.
So Desmond.
Right. So for many, even in those areas which have been specifically closed down, work has continued. Shop workers have gone in to revamp the stores to continue with stock taking. In hospitality, a huge amount of maintenance has been required to be done, not least in the large holiday parks that predominate in my constituency. So for many people, it's not a question of going back to work. They've been at work. And I now want to ask you, with respect to those that have been specifically closed down and have closed down, to what extent are you involved with the decision that will be made when they can reopen?
We are not the people who decide which sectors of the economy will or will not be operating. That's not us. What we do is regulate and observe those places that are working, by whatever definition. I don't know whether, Sarah, you want to add to that, because I know you've been involved in some of the debates around this. But essentially, I would also pick up on your point. We also recognise that a lot of people have been working. And that's why we have made sure that our regulatory activity has continued wherever possible, where there is a workplace activity going on.
So do you have involvement in setting the conditions that will be required to be observed when those sectors reopen? And do you have all the information that you need from the government to fulfill that task, if indeed you have that task?
The return to work situation, I think, Sarah, you've been quite heavily involved in this particular facet, and it's probably appropriate for you to pick this up rather than me.
So yes, thanks, Martin. So we are not involved, just to be clear, in the decision about when to open different sectors of the economy and which businesses can or can't open. So that's not us, and we aren't playing a part there in those discussions and decisions which are being made in the very centre of government. Where our role comes in is working with BEIS and with other government departments, taking, as I guess we said right at the beginning of this evidence session, the scientific evidence provided to us by PHE through SAGE and others about what are the risks about how this disease is transmitted, taking some of the work that Andrew and his subgroup of SAGE are doing at looking about what does that practically mean in terms of a work system, and then translating that into practical guidelines that employers can follow to help keep their workers safe in the workplace. And that's the work we've been doing with BEIS, and that's the close working that resulted in the various publications by BEIS yesterday looking at the different work sectors.
Okay, I think
and you're happy with that?
Professor Simpson wants
yes.
to say something.
Yeah, yes, I mean, again, PHE doesn't make the decisions on this, but what we will do is give advice from a public health and scientific point of view on what the risks may be if a sector is going to be opened, as Sarah said. And one could pick things up such as hairdressing, where you do have very close contact, and are the ways advised on are the ways that could be that those risks could be reduced to an acceptable level. So that's it, but we don't make the decisions either.
Can I just ask Professor Curran, you're a member of SAGE, will SAGE express a view about which sectors should open and when?
I don't think so, no. I think that what SAGE does is review the evidence, and as Sarah said, the subgroup that I'm a member of is looking at some of this now that would enable people to make informed decisions either as policymakers or employers as to when it is sensible to move back. So, for example, things like understanding the routes of transmission, understanding how mitigation can be best put in place based on the best available evidence, understanding how the interactions will work between the employees and members of the public, for example, so that all of those issues can be thought through, the best evidence can be identified, and then people can use that to make their own informed decisions about how to manage the risks based on that information.
Okay, I think Ben wanted to raise a point.
Thank you. Do you think using a sector approach is too blunt at all? I mean, as you've been talking in terms of your interactions with the guidance, I mean, there's lots of, a shop can be huge, it can be small. with different modifications made for social distancing, there's a variety of different businesses which may be part of an individual sector, but a lot of granularity in terms of how they operate and what risks are exposed to. And what are your thoughts in terms of that going forwards on return to work and guidance around that secretarial approach as opposed to an individual business approach?
If I can come in there, I think one of the things that we've been thinking through is, as you've said, a particular job isn't just one thing. It comprises a number of different individual activities in a number of different geographies or locations potentially. So you have to understand how all of those fit together to understand the total risk that you might be exposed to, or indeed exposing members of the public to. So I think from my perspective, it's really important that employees start that thought process as soon as possible, so that they can then deliver the requirements for a risk assessment based on their specific circumstances, which may not be the same for every bit of a particular sector. So I think that task-based approach to understanding risk becomes really important to enable people to assess appropriately.
Okay, thank you. Steve McCabe.
Thank you. This is actually a very straightforward question. I just wondered, we see a lot on the news about international comparisons, and we hear lots of arguments about how easy it is to make those comparisons. I just wondered, is the HSE coordinating with their international counterparts on the issue of coronavirus? And if so, what have you learned and how's it being shared?
Shall I come in from a starting point on the science side? So there are a network of European laboratories, which we call the Partnership for European Research in Occupational Safety and Health. And very early on, soon after the coronavirus issues began to become apparent, we set up a forum where we could share information very quickly. So, for example, when HSE was asked to undertake a rapid evidence review on behalf of Sir Patrick Vallance, we used that network to see what other parts of the national networks, or the international network of national health and safety laboratories, were actually doing in this space. So certainly from the science side, we've made very good use of those international links, not just in Europe, but also globally. So I chair something called the Sheffield Group, which is the international network of national health and safety labs. So we've had conversations, for example, with our colleagues in America through NIOSH and in other parts of the world. So from the science side, certainly it's very joined up.
Okay. Thank you. I think Ben wanted to come in on that one as well. Yeah.
Yes. And how about PHE for that matter? I mean, how are PHE working in terms of international on this? I mean, this is a national pandemic, and we're seeing across the world in terms of what's happening with people doing lockdowns and all different things. You know, Sweden, France, etc. What are you learning, and how are you collaborating with Centre of Excellence abroad?
Professor Simpson.
Yeah. We in public health, rather like as Andrew's saying in the health and safety science side, we have very significant international collaborations and international discussions and groups which are going on all the time in when we don't have something like coronavirus. So we're obviously we exchange information sometimes via WHO, sometimes on one-to-one or smaller groups, and we do have discussions on interventions, particularly on the health side, on the treatment side. We also interact with each other on response measures, because obviously one very important thing for us is if other countries change their response measures, how is that affecting their numbers? And so we are doing this all the time. It's, I say, on the public health side with WHO and with various of the European bodies, this is an ongoing conversation. It's something we're doing all the time. We just, in this sort of circumstance, we ramp it up.
Okay, thank you very much. Neil Coyle.
Thanks, Chair. Sarah, you mentioned earlier that only 71 occupational deaths as a result of coronavirus exposure have been reported to you. Given that we know there's been over 100 healthcare worker deaths, 29 care workers and 47 in transport for London alone, why is that figure so low when there was a requirement to report to you? And what are you doing to improve reporting?
So you're right that we have noticed that we think that it's at least likely that we've had some significant underreporting, and that is particularly in NHS settings where we've had very, very low numbers so far reported through to us. There's a number of reasons why that they may have been slow in coming through, but we are concerned that we aren't getting the numbers we'd expect, and we've been taking that up both with the NHS at a sort of national level and with individual health authorities, and we will pursue that.
So what does that look like? Why do you think, given that if a registered medical practitioner confirms that the death is likely due to occupational exposure, where is the gap in awareness amongst the professions most involved in this? Why are they not coming to you? What is the barrier?
I don't know. I don't think there is a barrier. I wonder.
Clearly, there's a barrier because they're not being reported.
Well, I'm not sure there's anything getting in the way of people being able to report to us. Of course, I don't know why they haven't yet done that, and I don't know whether it's simply something that they are late in doing or a misunderstanding of the RIDDLE regulations and what's required to be reported. But that's why we are taking that up with the NHS and with individual trusts to remind them of their obligation to report to us.
And you also know where where the risks are highest from the stats that you and others have provided. So, what are you doing proactively to contact those? And can you confirm? I think you said in answer to an earlier question there have been no closures even following the death of an employee due to coronavirus exposure.
Yes, that's right. We have not closed any business for any reason following, whether it's about a death or any other reason. We haven't issued a prohibition notice on any activity. I think it's important that the committee understand that although we will investigate and rigorously investigate all of the deaths that meet the selection criteria, and just for the avoidance of any doubt, we are not changing our normal incident selection criteria. So we are intending to investigate all deaths in the same way that we would whatever the cause, using the same criteria to select where it's appropriate to investigate death. And we will take that forward. But what an inspector would do and would consider when there's an immediate death is whether there is a remaining uncontrolled risk that requires immediate action in order to ensure the ongoing immediate safety of individuals. And we haven't, as I say, had a level of concern reported to us around individual healthcare settings that is such that we would feel a need to intervene and prohibit them from continuing to work.
So despite knowing about the higher risk of some workers, including care workers in care homes, which of course affects the residents as well as the workforce, you haven't yet proactively inspected additional care homes as a result of the high risks that you've been aware of?
I said we haven't yet prohibited any activity or closed a business.
So can you provide the committee, I don't expect you to have this, it'd be useful to know if you have it to hand, how many inspections have actually been undertaken on care homes? And I appreciate the circumstances could prevent some inspections, but how many have been undertaken each of the last 6 months, given that the alarm has been raised about care homes in particular for many months now?
Yes, I'm happy to. I don't know, but I'm happy to find out what information we do have and to write to the committee.
And I'm just keen to explore, you said you will contact health trusts. Have you already been contacting health trusts, local authorities and care home operators to remind them of their duty to report to you?
I believe that we have, but I haven't seen the direct letters myself, so I would need to double check that as well and write to you. I know it was the operational team's intention to make proactive contact and remind people about their duties to report under RIDDLE.
I do find it worrying that the chief exec of such an important organisation says they don't know. Can you share that correspondence with this committee, please?
Of course.
And can you tell us, and the additional, I know you've lost half your budget since 2010, I know that, but the additional resource that was announced yesterday, can you perhaps share with us the forward plan and how you'll be increasing inspections and protection for people and employees most at risk? And perhaps you could share with us how you'll target some of the professions most at risk?
Well, as we make a plan, I'm very happy to share that with the committee, but we also found out about this additional money yesterday.
So you didn't know before yesterday that this might be coming, so you've been unable to prepare before?
We were told yesterday that this additional money would be coming.
Right, okay. And obviously with the additional data on professions most at risk, will you be publishing more data and before July? And will it include the regional breakdown and employment professional breakdown due to deaths due to exposure in particular?
I would need to double check whether or not riddle reporting publication is covered by the national statistics requirements. It may be that the reporting of statistics under riddle and the publication of those are covered by the ONS requirements, which mean that dates are set and we have to follow those specific dates set out in order to ensure that reporting is regular and is not infected by particular sort of political or any other spin that might be put on it. And I suspect that riddle deaths may well be covered by ONS reporting requirements. In which case the answer is yes, we'll report them, but we'll report them to the schedule that we're required to report.
I'm not sure if that's a yes or no, Chair.
I think it's a yes, isn't it? About
yes, but
not quite sure when.
Mm.
Yeah, Martin, you were indicating. Martin,
I just not wanting in any way to take anything from what Sarah said. I just want to remind people that we've been using the phrase care homes again, and some of the things that we won't know about are because local authorities may well be doing it, or in fact, in some cases, CQC may be doing something about it. I just wanted to make sure people realize that we don't actually have the full picture here, even though the points being made are still relevant and important. I don't want to detract from that main point, but that's partly why there isn't a complete picture. And I do know from I'm involved with one of the large teaching hospital trusts. One of the things which I learned yesterday was that, as I understand it, and it may be possible, John may be able to clarify this, that actually if a health worker died of a COVID-related illness in, say, one of our hospitals, but worked in another hospital where they may well have actually got the illness, then actually it is the hospital that treated them, not the employing hospital, that actually must make the report. And I think there are some, that's sort of new, and I think not always being clear. So the only point I make here is that there are some areas of lacking of clarity at the moment, which may result from some underreporting. Again, I don't want to detract from that very important point you're making. I just want to point out that within all this that's going on, there are some slight confusions, which hopefully will get resolved. And as Sarah has said, every death that has got a COVID-related name next to it, we will be looking at from the beginning and then going back.
Yeah, just a final point, Chair. Thank you for that clarification. I think it would be really important just to know what measures you have taken against those care homes you are responsible for following the report of a death due to occupational exposure to coronavirus. That would be really useful in that follow-up information. Thank you. Thanks, Jeff.
To be covered in the further information to come. Professor Simpson, very quickly, if you would.
Very quickly, just to say that what Martin has said is quite correct, is that the report would be from the hospital where the person was treated. Hopefully there would be a note to say where they worked.
Yeah. Okay, fine. Thank you very much. Steve McCabe's coming back.
Yeah, I just wanted to ask two very quick things, Chair. I wondered, given that the Prime Minister put quite a lot of stress on the 5 levels on his indicator in his broadcast, I just wondered what are the kind of key metrics that will be used by Public Health England to monitor things like the infection rate and the number of cases. And perhaps if I could just, on the back of that, ask, given the ONS statistics yesterday, how are they going to modify the guidance? We saw that quite a few professions appear, or quite a few different occupations appear to be rather high risk. Presumably that hasn't been factored into the guidance yet. Who's going to take responsibility for that, and when will we start to see it?
Okay, so the first point, I think, is for Professor Simpson.
Yeah, on how the monitoring will happen, it will be continuing as we do at present. As everybody is aware, there are the number of tests that are being done has been ramped up considerably, and there are 4 pillars of that, and that's collated. Although Public Health England's only responsible for one of the pillars itself, that's all collated by us in the figures that comes, and that we also come together with the deaths figures. So the important part is that continues consistently. So we have those figures, and then we can feed those into the model.
Professor Simpson, can I just ask, with so many more people returning to places of work, will there be any change in the testing arrangements? I mean, the criticism we've heard is that people are being expected to travel huge distances to these mega test centres. Is there a plan to change that? I mean, how are you going to keep on top of the risk of an increase in the infection rate in workplaces?
Well, as you're aware, the number of occupations and groups who can be tested has been increased quite considerably over the last 2 weeks, and the amount of testing available will be being increased, and therefore it will be much easier for people to get tests. There have been mobile military testing groups who have been going out and getting this closer to where people live and work. So that is being dealt with, and obviously, the more testing you're going to do, although the incidence in the population is dropping, you may seem to see some small increases. So it's quite important that we transmit and communicate that sometimes some of the small increases are due to more testing, but that's what will be done over the next few weeks.
Okay, thank you. And the other question, I think probably one for Sarah, or Professor Curran indicating, did I see? Yeah, Professor
yes,
Curran.
sorry, Chair, I just wanted to come back on that last point, because I think that it's important to realise that we're not at the end of the story yet when it comes to data, and clearly we need better data to make more informed decisions. So one of the things that we are working on is to try and include occupation as one of the data points that are collected when people, for example, enter the system, be it through the hospital or through other of the testing routes. So I think it's really important that we understand that that is an ongoing situation, and that at the moment, the information that's coming out is an early pass at that data, and it will need to be analysed a lot more, I think, before we really understand the true cause-effect relationship. At the moment, it may just be correlation as opposed to causation.
But presumably, if you were a construction worker or a taxi driver and you saw the data that was released yesterday, you'd be a bit worried.
I can understand that completely, yes. So I think, in terms of how that data is communicated, it's really important that people understand that it isn't the end of the story, as I say, that there are certainly a few more chapters to come before we know who did it.
I think, Steve, your other question was whether there are going to be changes to the guidance in light of that data yesterday. Is that something, Sarah, that you can comment on?
I mean, the guidance itself is obviously principally owned by BEIS. I'm not aware of them intending to update the guidance in the light of the data yesterday, but I'm sure they'll want to have a good look at it and have a close understanding and conversation about whether or not any updating would be appropriate.
Okay. Thank you, Steve, very much. We come then to Sean Bailey.
Thank you, Chair. I just wanted to very briefly touch on working from home. As a result of this, as a result of the crisis, I think we're going to see quite a rise in the number of people that are working from home. And from that end, what I'd be really keen to sort of understand a bit more is, firstly, more generally, how the enforcement regime works for people that are working from home. I'm assuming the enforcement regime is still the same, and also, and maybe one for Sarah, if you've got any data at all around queries that have been raised or any complaints that have been raised around sort of work from home arrangements at all, and sort of what engagements you've got with organisations around advising them about work from home. I appreciate, obviously, there is already guidance on that, but whether or not you've done anything in addition to that at all.
Yeah, sure. And I guess I can probably speak from two perspectives. One is obviously as a regulator, but also as an employer, where we have the vast majority of our sort of over 2,000 staff ourselves working from home. So the position is different depending on whether or not the working at home is an occasional or temporary working from home, or if it's sort of your main place of employment. Either way, the regulating body still is either HSE or the local authority, depending on who your employer is. So it's the nature of the overall employment, not your particular location, that will determine whether it's the HSE or your local authority that's your employer. We took the view in the early stage that the sort of the immediate work from home, if you can, was effectively a sort of mass temporary working from home that didn't require employers to necessarily do a full DSE equipment check for each and everyone's home, didn't necessarily require them to provide sort of full additional equipment to people's homes. And I think it's really important here to also recall and think about the fact that not everybody has a home that is necessarily capable of being set up in a kind of permanent office way, because it not only needs the IT kit and a screen and a chair and those kind of things, it also needs the space to put those things. And it's important that we remember that not everybody is lucky enough to have the space to just straightforwardly work from home. So we took the view that in that initial phase, it should be considered temporary, and that as part of that, it's still important, though, that employers don't expose their workers to injury as a result of perhaps using, hunching over a laptop or something like that. And therefore it's appropriate to let people perhaps take a break more frequently, accept some lower productivity and those kind of things. I think if we're potentially moving into a phase now where at least some part of the workforce are considering really extended working from home, then that is going to make employers and us, both as an employer and as a regulator, start to look at whether or not, and where the point becomes where you have to really consider that a full home working environment, which needs to be set up with the right kind of kit and can only be supported if your individual employee has got the right environment in which to put that. And that might actually start to inform, as some office workers come back to work, it may, along with the kind of work that needs to be done, start to inform employers' views about who should return and the right order of that, because clearly office space will also be at a premium as and when the message to work from home, if you can, is eased up. I think it's most likely that a degree of social distancing will still be recommended. And so we would expect, I think, for a protracted period to see at least part of the workforce working from home and greater social distancing maintained in offices. Although, as I say, the current message is clearly work from home if you can.
Thank you. Just on that, if I can, Chair, just very quickly. Obviously, as you say, Sarah, it might be the case that we do move into a more permanent phase of people working from home. I'm just conscious with, I suppose, for larger businesses, if we were to perhaps, there was perhaps more of a bespoke scheme or much more, that moves out of this sort of ad hoc scheme, they may be able to comply with it, but sort of smaller and medium-sized enterprises, if they're having to then outlay lots and lots of money so that their employees are sort of compliant with some of the guidance, that in itself might present issues, which then leads to some SMEs perhaps maybe flouting those regulations. So I'm just curious as to what your views on that. Or if we do move, as I say, if it looks like in some elements of the economy we do move into a more permanent or semi-permanent work from home structure going forward, really, and particularly around the SME sector as well?
I mean, I suppose it's really going to vary, isn't it? So if you're a very small employer, you may find it more straightforward to facilitate social distancing back in your workplace if you already don't employ very many people. So I think it's really going to be sort of horses for courses, and for employers to understand as the restrictions gradually over the coming months ease off. And I guess a lot of this is going to be driven as much as anything by the requirements across public transport, and actually thinking about the safe ability to get people to work, which really plays to the points that Andrew was making about thinking about work as a system rather than just a thing that people do. But you know, the bottom line is that although I'm sure that some businesses will find it more straightforward than others to provide the kind of kit that they need to, as a regulator, the view that we need to, and the lens that we will look through this on, is that it's not acceptable to injure your workforce. And so, you know, if people need to provide particular kit and to give people facilities in order to work at home, and that they can work at home safely and without injuring themselves, then ultimately they'll need to do that. And we will take enforcement action in our sectors if people are unable to do that or choose not to.
Okay, thank you, Chair.
Okay, thank you very much. We are into sort of injury time now, but there are a couple more points I think we would like to cover. Ben Spencer had a point you wanted to raise.
It's just a follow-up on the international collaboration question that we touched on earlier. One key industry which needs to get flying again is the aviation industry, and by definition that's going to require international collaborations in terms of safety for all involved. Are your departments, and this is to the professors now, looking into this and collaborating with international colleagues around that and how that can operate?
Sorry, it's not something we're looking at the moment from a specific sector, and certainly from a regulatory perspective in the UK, the Civil Aviation Authority may be involved in some of that work, but it's not something that I'm aware of, I'm afraid, no.
Okay, thank you.
Okay, fine. Can I just raise a couple more points? Professor Curran, you made the interesting point earlier on that the normal requirement is 2 meters separation, but if it had to be for a meter, if that was for a few seconds, that would probably be okay. Can you just tell us a little bit more about the thinking there and the extent to which this flexibility has been spelled out?
It's a really difficult issue for people, I understand, and you know that as Professor Simpson mentioned, I think that the international variation around this doesn't help. And essentially, what we're looking at is the laws of physics and how far particles of certain sizes will travel under certain conditions. And of course, that's not a very easy thing to model in workplaces because, for example, if you cough, the particles will travel further than if you are just talking naturally. So there's a lot of different factors to bear in mind when doing some of the maths around this. That's why the 2 meter rule has been sort of established as the best rule of thumb. But I think the important thing is that as the evidence develops, and certainly, as I say, the SAGE group that I'm involved in is looking at this, there will be better information for people to make more informed decisions once we understand a bit more about the transmission of the virus, how it moves in air, how it moves in particles, and that will help us make better informed decisions. But at the moment, that 2 meter rule is the best we've got. There are some circumstances which, as I've mentioned, relate to duration, which will help people make a sensible judgment. If you're passing in a corridor, actually, if you pass for a couple of seconds, do you really need to be 2 meters apart? Well, probably not. So there are those sort of judgments to be made based on that evidence, which will be evolving and being refined over the coming weeks and months.
Okay, thank you. And can you give us an insight into how SAGE works? There's been a lot of interest in this, and kind of it's fairly opaque from the point of view of outsiders. But what kind of engagement do you have as a member? Perhaps can I ask you, how long have you been a member of SAGE, and what does your participation in that entail?
I think the first thing to say is that obviously SAGE is organised by the Government Office of Science, and really the questions in relation to its operation and membership should be directed to them. I can give my personal experience, and of course, SAGE is not a membership group it's sort of brought together depending on the nature of the emergency and the specific expertise that's required for that emergency is drawn upon throughout both the government science community and the wider academic community. I have been to a number of SAGE meetings. I haven't been to all of them. I certainly wasn't involved early doors, but as the crisis developed, the kind of work that HSE has been involved in, particularly from the science side, became of more importance and relevance. And I see it personally as an extremely good way for scientists from around the academic and government communities to have an open and frank discussion about the issues, because science isn't just an answer. Science is a series of activities that bring together different views about a subject to create a consensus. And the advantage of something like SAGE is you can have that open conversation and come to a consensus about an element of the COVID situation, which can then feed into policy. And my personal experience, this is my personal view, is that those conversations are extremely high quality. They're very robust and provide, I would hope, the best available evidence that there is for policymakers and others to make properly informed decisions.
And have you participated in SAGE prior to the COVID-19 pandemic, or is this your first involvement in it?
I have been involved in SAGE previously, so I think it's a matter of record that if you go on to the gov.uk website, you can see previous minutes of SAGE activities. So to give you an example, I was involved in the Whaley Bridge Dam issue, and the minutes of that are available on the gov.uk website. SAGE also undertakes exercises at regular intervals, and I have been involved in those as well. So a scenario is presented to the group, and the group will review that and go through an exercise to essentially doing an exercise situation, what we're doing for real at the moment. And that's very helpful to provide that sort of opportunity to make sure that the process is properly working and that everybody understands what their role is, because that's also really important.
Presumably at the moment the meetings are virtual rather than physical, and how frequently are you attending SAGE meetings?
At the moment I'm attending all the SAGE meetings, so they tend to be twice a week. I also attend the subgroup meetings of the environment and modelling group, which also tend to be maybe twice a week, and they also spin off other meetings with other parts of government. So it's fair to say that from a science perspective, I think the draw on my time and my colleagues' time is hopefully demonstrating that because this is driven by the science, there's a lot of science activity going on to ensure that we've got the best possible input to make the right decisions in the right way.
A lot of demand. Thank you. And can I thank all our witnesses very much, Professor Simpson, Professor Curran, Sarah, Martin Temple. Thank you all very much for joining us and being so generous with your time and giving us such helpful answers to all our questions. That brings our meeting to a close. Order, order.